Oftentimes, when we're listening to a person's story, we have the good intentions of wanting to help them and wanting to say the right thing, but sometimes they come across as being hurtful. So, I want to inform you on what to say or what not to say to individuals or couples who are dealing with infertility. My name is Melissa Peterson, and I am a therapist here at Mayfield Counseling Centers. And today I'm going to talk about some of the statements that are often said to individuals and couples who are dealing with infertility. These statements are: relax. Have you thought about IVF? Are you sure you're doing it right? Just adopt. Whose fault is it? Are you doing all the right things? Have you thought about drinking this, eating that, taking this, doing that? I've never had that problem. My husband or my partner will just look at me and I become pregnant. I've always been fertile. I don't know what I would do if I were in your shoes. Kids are a lot of work. Trust me, you're better off. My friend or we adopted because we couldn't have a baby. But then later we had a baby. So try that. Maybe adoption, and then maybe you'll have a baby. Maybe you're not meant to have a baby or even be parents. Just focus on your career. Oftentimes we have these good intentions to say these statements to people because we get into a place of where we want to help problem solve. Perhaps we're even feeling uncomfortable or awkward that they're sharing this with us. And so we want to try to fill those gaps of brainstorming or thinking more logically about it versus maybe sitting in that emotional space with them. I want to encourage you as the listener who is in that space with the person who is speaking about their pain to take time to utilize a very basic technique, and it's called active listening. You simply just listen to what they're saying. You see their nonverbal cues, like maybe slumped shoulders, or maybe their face looks really concerned or it looks really sad. Being mindful that what they're sharing with you is important to them. Perhaps you've never experienced that. Perhaps you don't know what you would do if you were in their shoes. But what they're wanting to hear you say is something more of, I'm sorry that you're dealing with that. That sounds really difficult. I may not know what to say right now, but I'm going to sit here with you. And if you want to keep talking, I'm here to listen. And that may be all that that person or that couple needs you to say. Oftentimes, along with some of the things that we have good intentions in saying, we try to implement our own perhaps religious or spiritual values or our own traditional values, and we try to guide them along that way. There may be some good intentions with that, but always make sure that if you become the speaker, that you speak with the language that the person who is talking with you will be able to receive it. Perhaps after you've, tried your best to say the right thing, perhaps you've listened, you've given them space, and now you feel kind of lost as to how to even talk with them moving forward or how to connect with them again. We might be tempted to hide or run away or not reach out to them because we're uncertain of what to say or what to do for them. The individuals and the couples that are dealing with this situation, be mindful that this is an emotional component of their life. It's not a logical component. It's not just filling out a job application or typing in the address to your GPS system to get to the next place. This is a space that creates a lot of emotional grief and it may even accelerate into places of anxiety or depression. You're not expected to try to pull them out of it. You're not expected to try to make things better, but you can be expected to be the relationship that you've already established with them. And that might be if you're a good friend, or if you're a parent, or if you're um, a leader in their life, like a spiritual leader or a mentor, that you continue implementing the best of your character and your qualities that you've always done in this relationship, and you meet them in this area of their life. An example of this might be that you're a coworker. You don't really have a connection with this person that maybe goes beyond the work environment. And they're expressing to you their difficulty of having children and what they're struggling with and what they're dealing with. And the context of the relationship is now being, for that person, they're they're looking for someone to listen to them. They're looking for a place where they can create space, and they have in some ways found you to be that safe person. However, you may not feel comfortable being in that space with them because the context of your relationship is just professional. In that case, one of the most basic things that you can do in that situation is to use empathy by stating something like, I'm sorry that you're dealing with this. It sounds really difficult. And if it's a situation that accelerates where they're maybe coming to you a lot, you could refer them and say, I I may not be the best person for you to talk to about this. And I want to be able to respect your heart and your time and your energy. It may be really beneficial for you to look into talking to someone about this, like a therapist or a closer friend,